Forward torso bends are a simple exercise that everyone knows from kindergarten. Bends are easy to perform and they do not cause great load for the body, so this exercise is perfect for those who want to tone the muscles, to be in good shape, and to improve the elasticity of all muscle tissues in the body. To ensure that the load on the body is not dangerous and the exercise brings the necessary effect, we recommend you to follow a number of safety rules. Follow them and you'll notice amazing changes happening to your body. Before we continue, please subscribe to the channel to get notifications about the new videos. We're doing our best to create interesting content for you. Why do forward bends bring great benefits to the body? Forward bend is one of the most common and natural poses of the body, along with the straight stance. To perform this exercise, you don't need any gym equipment or a couch. It can be done with any body weight at any age, by people with any level of physical fitness, and absolutely anywhere. You can do bends in comfortable environment according to your individual training schedule. This simple exercise may bring you a lot of health benefits. If you do forward bends daily, they will improve a variety of health aspects and the performance of the body in general. Forward bends increase the flexibility and elasticity of the spine, increase the mobility of the pelvis, improve blood circulation in the body, normalize the work of the gastrointestinal tract, strengthen the muscles of the back, lower back, buttocks and thighs, reduce the risk of traumas, congestive and vascular problems, and finally eliminate the overload of muscles after physical exertion. What muscles are involved in bends? Many people are convinced that bends strengthen only the oblique abdominal muscles, but in fact, it's not true. If you perform the exercise right, many different muscle groups will be involved, including straight, oblique, and transverse abdominal muscles, lats muscles, buttocks, back parts of the thighs, and deep lower back muscles. In addition, bending loads spine extensor and stabilizing muscles, which improves posture and eliminates back pain. How to do the bends right. Despite the fact that forward bends are very simple and literally everyone can perform them, it is necessary to follow certain rules to achieve the greatest effect from the exercise. Step 1. Stand up straight. Place your feet shoulder width apart and check your posture. Feel the natural deflection in the lower back. Step 2. Tighten the abdominal muscles and lean forward, pulling the pelvic area back. Lower to the torso as much as possible. 35-degree angle will be good to begin with. Step 3. Every day the muscles will become more elastic. The angle of bending will increase, and you will feel that performing the exercise have become much easier. To ensure the right load distribution in full bend pose, don't bend your knees and stay in a static position. Step 4. You may put your hands on the belt or pull them straight forward. This will load different parts of the spine. To load the muscles quickly, effectively, and with no harm, 3 to 4 sets of 12 reps will be enough. After a day of exercising, there should be a day of rest. The variations of forward bends. Once you've mastered the standard forward bends, you can move on to more complex variations of this amazing exercise. Thus, you will be able to give a greater load to the deep muscles, which are quite difficult to strengthen. Various types of bends can be done in tandem or alternated on different days of the week. If you don't need great load, you can make up your own training program depending on your goals. Here are some variations of forward bends: slow bends with stops, bends with touching the floor, bends with dumbbells or a ball, bends with the legs brought together, bends with a gymnastic stick, which must be held above the head with both hands, bends with the feet spread apart, bends in the splits, and bends with raised head. What to do if the back hurts during bending? Back pain during physical exertion usually indicates the ailments of the spine or internal organs. Most often, this is a sign of inflammation of the spinal root, which appears in case of spinal disc herniation or other diseases. One of its major symptoms is pain occurring when the head is bent forward to the chin, when the abdominal muscles are strained, when a leg is raised to a horizontal position, or when you just stand up. Also, pain may occur when you touch the spine. First, the irritation of the nerve endings stabs slightly in the lower back, but then the pain may become more blunt and even chronic. If your spine aches during bending, be sure to talk with your doctor about the following diseases: spinal disc herniation. Damage of the spinal discs cause the compression of blood vessels, and so pain, sensitivity disorders, and even numbness may occur. If you do forward bends, this disease gives off acute stabbing pain in the legs. Ankylosing spondylitis. The main symptom of the disease are sore and hardly flexible joints. The other symptoms are stiffness and acute pain in the morning, which become even more severe when you do bends. However, after morning exercises, the pain may go away. Osteoporosis. The body lacks calcium and so bone tissue deteriorates gradually, which often causes bone fractures and spine cracks. Pain during bends may be a sign of a crack in the spine column, and if you can't straighten up, there's even risk of fracture. Osteochondrosis. It is the process of deformation of vertebra caused by heavy loads. In this disease, the aching pain during forward bends occurs in the lower back or neck. It goes in tandem with general weakness and fatigue. A tumor in the spine. Sometimes cancerous pathologies develop into a nerve, which causes the deformation of spine column. Acute pain after any motion indicates that you need to go to the doctor. Dislocation of the vertebra. Due to their incorrect position, the risk of a fracture is very high. When bending, the pain reaches the legs and lower back. Also, when you do forward bends, pain may occur in stenosis, neuralgia, sprains, and spine curvature. And sometimes it may be caused by pathologies that are not related to the spine, like kidney inflammation, gastrointestinal disorders, heart attacks, and gynecological diseases. Who should not do forward bends? Here's the list of main contraindications. The expansion of the gluteus can be painful if one has weak hip bone, so it's better to avoid if you're not confident of your hips and muscles around the gluteus. Don't practice bends if you have a hamstring or knee injury. Avoid this pose in case of migraine, as the pressure to the head with sudden flow of fresh blood may create more stress leading to heavy head. Pressure at the abdominal area may not be good for someone with severe abdominal ailments, as it could bring in more irritation to the stomach lining or the intestines. Also not to be done right after meal, as the pressure towards the stomach can cause indigestion. Anyone with neck problems should avoid this pose, as the neck and the head hang downwards, which may aggravate the stress. Any kind of severe joint pains can aggravate the situation if practiced without proper guidance. Hence, it's advisable to avoid this exercise if the joints are not strong enough or there's an injury at the joint. Any kind of injury to the shoulder or the upper back will bring more stress, hence better to avoid. Pain in the knees, any kind of pain in the back, and high blood pressure are also important contraindications for this exercise. If you decide to do forward bends in a sitting position, you should know a number of tips and rules. Number 1. Breathing should be as deep as possible. You should not feel discomfort in the chest area. Number 2. It is necessary to tense the leg muscles and to relax shoulders and arms. Number 3. In order to stretch the muscles of the spine column properly, the thighs should be turned outwards and the buttocks should be spread in different directions. Number 4. Don't make sudden movements when you perform this exercise. Number 5. Your goal is to make the back muscles strong, not to reach the floor with your forehead. Number 6. The back should always be straight and plain. Number 7. The knee joints should not bend. And number 8. Do not help the torso with your hands, as it can cause injuries of the lumbar region. Some doctors call the psoas muscle the organ of the soul. Problems with it, which arise from the lack of physical activity, may harm the health of the body in general. How do the lumbar muscles affect our body? The Chinese call the psoas muscle the throne because it encircles one of the main human energy centers according to their traditional teachings. This muscle is the base of the body, through which all the energy flows pass. Malfunctions of this muscle cause disturbances of the digestive tract and serious liver problems. If lactic acid is not removed in time, toxins form inside the body, the number of collagen structures increases, and the level of proteins responsible for tissue elasticity decreases. This disrupts the condition of all the joints throughout the body, and spinal discs in particular. These are the common consequences of sedentary lifestyle. To protect yourself from various diseases, do 2 or 3 sets of forward bends a day. The sages of Tibet say that it's necessary to do about 140 to 160 bends every day to keep the joints flexible and to improve the health of the liver. They say the more bends the person does, the longer they will live. If you feel mild pain or uncomfortable sensations when you do forward bends, your back muscles are simply not strong enough yet. So in the first weeks, 20 to 30 bends a day will be enough. Then the muscles will get stronger and you will be able to do more reps. In 3 months, you will do 100 to 150 bends per day without much effort, which is enough for the prevention of any diseases of the musculoskeletal system. Why are forward bends so beneficial? This exercise normalizes the oxygen exchange in the body. If certain cells of the body do not get enough oxygen, a congestion may occur. It will lead to the accumulation of wastes and later to the formation of toxins that poison the body. In addition, toxins can get into the body with food, water, and drinks, and they stay in the organs if the cells are not provided with enough oxygen to effectively remove these substances from the body. Forward bends accelerate the blood flow, which, like a river, carries freshness and oxygen throughout the body, and so removes the waste products and toxic substances. And if you lead sedentary lifestyle, the blood stagnates, and the organs work to the limit of their capabilities. As a result, they simply cannot function properly. In a way, the exercise reminds the body that the internal organs can work in a normal, calm mode without performing the function of circulatory system. Bends strengthen your bones and muscles. Even the simplest forward bends significantly improve the mobility of the entire spine and its upper part in particular. Do the bend slowly, linger in the upside-down position, and arch your back as you align. You will feel how all the muscles of the back stretch and contract, giving you a pleasant, incredible feeling of freedom. And side bends are even more effective exercise that strengthens the muscles of the lumbar region, subscapularis muscles, and the structure of the spine. The benefits of this exercise for the body are undeniable. It normalizes blood circulation and increases the elasticity of muscles and tissues. Bends affect the meridians of your torso. Experts divide the human body into 12 basic meridians. These are the conductors of vital energy that human draws from the sky and earth. Any relaxation technique in Eastern practices is based on strengthening of these meridians. This is the way you can control your body and protect it from various diseases. Simply put, it is necessary to do bends and stretches regularly. Warm up, bend down, lock in this position, arc your spine, and then align slowly. Then move your shoulder girdle, rotating the body while standing still. You will immediately feel a slight warmth, similar to an electric current running through your body. If the sensation came, it means that you had done everything right, and now you're a bit less prone to intervertebral hernias and other diseases of the spine. Do forward bends regularly, and your mood, body tone, blood flow, and the condition of internal organs will improve. That's all we wanted to tell you today. On this channel, you will find videos about the benefits of different foods, about diseases and effective methods of their treatment, as well as interesting information about housekeeping and gardening. So make sure to subscribe to Big Progress and ring the bell, click the like button under the video, and share it with your family and friends. See you soon!